Dr. Dylan Loyton. I'm an emergency physician. I'm a regional medical director for Cascade Training, and I wanted to make a few points about the extremity and pulse exam in trauma. So here's what you need to know about feeling for pulses. Sometimes I'll ask a medic if they felt a pulse in a leg, and they'll kind of go, yeah. And it's really important. If you feel a pulse, great. If you don't feel a pulse, that's okay. But don't say you felt a pulse if you didn't, because that's a real problem, right? So sometimes someone will come in and there's a report of a pulse, and then I'm feeling them and I don't feel a pulse. And that sort of implies that somebody's going in the wrong direction, right? That they're losing vascular supply to their leg, which implies more urgency and kind of changes how we think about it. Totally fine to not have time to get the pulse. Sometimes you got bigger fish to fry. Totally fine if you can't feel the pulse, because sometimes that's difficult in the chaos of a trauma scene call or within the rig itself and all the movement. But just be careful. Don't say there's a pulse when you didn't feel a pulse, because that has some serious downstream effects. It's totally fine to say, well, I couldn't feel a pulse, but the foot's warm, the capillary refill is good, or the hand is warm, but I just couldn't feel a radial pulse. That's fine.